Understand what female sexual dysfunction, FSD, means. FSD is only diagnosed if it is causing you significant distress about your sexuality. FSD can cause problems, or interfere, with a woman's ability to respond sexually. FSD can be generalized global, for example happens during every sexual encounter, or situational, for example only happens in certain circumstances. FSD can be primary lifelong, for example started when you first became sexually active, or it can be secondary acquired, for example began at some point after you experienced no issues with sex. Know about the psychological causes of FSD. Formal diagnosis of FSD from a psychological perspective is based on the definitions provided in the Diagnostic and Statistical Manual of Mental Disorders, which is used by psychologists and psychiatrists in Canada and the United States. There are 3 types of FSD as per this manual. Female orgasmic disorder, also known as anorgasmia, is when a woman has trouble experiencing an orgasm, or she is able to experience an orgasm, but it's not as strong as it used to be. Review the physical or medical causes of FSD. There are many physical and medical reasons why you may experience FSD. They include medical conditions including cancer, kidney failure, multiple sclerosis, heart disease, and bladder problems. You won't discover you have one of these issues because you experience FSD. Rather, one of these issues that you already have may be the cause of your FSD. Realize what FSD is not. FSD is not any and every problem with a woman's sexuality, and there is no normal for women to measure themselves against. Normal is what you want it to be and are comfortable with. Not being able to orgasm during intercourse, but requiring clitoral stimulation to orgasm, is not FSD. This is actually quite common among many women. Make an appointment with your doctor. Call and make an appointment to see your doctor to discuss your issues. If you already have a gynecologist, make an appointment directly through that office. If you do not have a gynecologist, ask your family doctor to refer you to one. Be prepared to discuss the following things with your doctor: your exact symptoms, what types of difficulties you're experiencing, when they occur and how often they occur. Answer your doctor's questions honestly. It may be embarrassing to talk about your sexual problems with your doctor, but understand that you need help in order to overcome them. Answering your doctor's questions openly and honestly will ensure you get the right treatment for what you're experiencing. Some questions your doctor may ask are: how much do the problems you're experiencing bother you? How satisfied are you with your current relationship? Be prepared for a pelvic exam. Some sexual problems may be caused by very specific things that can be found during a pelvic exam, or may be determined via a pap smear test. Your doctor will check for any physical issues with your genital tissues and skin elasticity. They can also check for scarring and may be able to narrow down where pain is occurring. Treat an underlying medical problem. Many sexual problems are caused by other conditions or medications that change the way your body behaves sexually. In order to reacquire your usual sexual desires and behaviors, your doctor may have to experiment with multiple ways to treat your underlying condition. Everyone reacts to medications differently. If a specific medication is causing your problem, your doctor might try a different medication instead. It may take a couple of tries to find the right medication or dose before the problem is resolved. Attempt hormonal therapy. If your sexual problem is linked to a hormonal imbalance or cause, your doctor may suggest a form of hormone therapy. Estrogen therapy is done using a vaginal ring, cream or tablet. It can improve vaginal tone and elasticity, increase vaginal blood flow, and enhance lubrication. While it sounds easy enough, it does come with some risks. Make sure you discuss all the side effects with your doctor before starting any type of estrogen therapy. Perform Kegel exercises. Women who experience vaginismus often have a feeling like they're too small for their partner's penis, and can experience burning or tearing sensations when something is being inserted into their vagina, including a tampon or speculum. The actual cause of the problem is the muscles in the vagina not being relaxed enough for intercourse to be comfortable. The cure is to learn how to control and relax your vaginal muscles through exercises. Make an appointment with a psychologist. If you think you may have FSD, and you also think there is no physical or medical reason for it, or you've already been assessed by a doctor, make an appointment to speak to a psychologist. Don't be embarrassed about seeking help from a psychologist. If you think there's a problem, and you want to fix it, they will be able to help. Find a psychologist who specializes in FSD or other sexual problems and issues. Answer your psychologist's questions honestly. A psychologist can only help you effectively if you tell them the truth, and are as open and honest as possible. Treatment plans will be based on what you said, so if you aren't honest, you may waste your time trying a treatment plan not designed for your specific situation. Your psychologist will most likely ask about the following things: a complete history of the sexual problem you're experiencing, when it started, what the exact symptoms are, etc. Develop a treatment plan. You and your psychologist will develop a treatment plan together. Your psychologist will customize the treatment based on your specific circumstances and needs. Some possible treatments may include cognitive behavioral therapy, CBT. CBT is used to help you identify and change the feelings, thoughts, and behaviors you have that are causing the problem. CBT is normally conducted on a weekly or bi-weekly basis with a psychologist, plus through at-home exercises you can do on your own. Open the lines of communication with your partner. It is important to make your partner aware of any issues you're having, and what types of treatment you're receiving. It is also helpful to speak openly to your partner about what you consider to be sexual satisfaction, including the things your partner does that you do and do not like. Focus more on the level of intimacy between you and your partner, instead of just on the sex. Increase the amount of foreplay before sex. Foreplay can include a lot of different activities, including watching erotic videos or reading erotic books, playing out erotic fantasies, sensual massages, or even a warm bath. The key to foreplay is that it is different for everyone, so you need to communicate with your partner in order to determine what works best for the both of you. You may also need to change it up every now and again to keep foreplay fun and exciting. Use a lubricant. Vaginal dryness, which can be caused by a large number of things, can often make intercourse uncomfortable and even painful. One potential simple and easy solution is to use a lubricant. It is worth giving this option a try to see if there is any improvement. There is a large variety of lubricants available on the market for you to try. However, be sure to read the instructions carefully, as some lubricants cannot be used with some other types of birth control, like a condom. Get a sex toy. If you are a woman who needs to have clitoral stimulation in order to become aroused or to orgasm, using a vibrator or other sexual device might be very helpful. You can either teach your partner where to use the device so you get pleasure, or you can use it yourself. Don't be embarrassed about buying a vibrator or other sex toy. If it works, it's well worth it. Plus, there are many online stores that you can order from that mail out their products in unlabeled boxes and disguise the company name on your credit card bill. Reduce the amount of alcohol you consume. Excess alcohol in your system has the ability to blunt sexual responsiveness. Cutting back on the amount of alcohol you consume may help alleviate sexual issues you're experiencing. Stop smoking. Smoking can restrict the blood flow in your body, which in turn means that less blood is able to reach your sexual organs. Less blood to your sexual organs can cause you to have trouble becoming aroused or to have trouble experiencing an orgasm. Take better care of yourself. Ensuring you get enough physical activity every week, eating properly, and taking the time you need to relax once in a while can have a long-term and positive impact on your sexual experiences. Regular aerobic exercise can increase your stamina and elevate your mood. Taking the time to relax now and again can help relieve stress and anxiety, and help you be able to focus on sexual activity. Consider acupuncture. While not for everyone, it is possible to use acupuncture to help relieve problems that cause FSD. If you already get acupuncture, speak to your therapist about the sexual problems you've been experiencing and see what specific treatments they may be able to perform. Take up yoga. Yoga, in general, is a great way to increase your flexibility and balance, and can reduce stress and tension. There are even yoga poses designed specifically to improve sexual functioning. If you are looking for a way to increase your level of physical activity anyway, consider giving yoga a try.